May is Mental Health Awareness Month, and the state of mental health across our country has never been more acute and more important than right now. All of us, every single person, experienced significant levels of trauma at various degrees during the pandemic. Everyone experienced some sense of loss in some way, but of course, our more vulnerable populations were disproportionately impacted, and we are all feeling the effects of that across our country right now. Our youth are screaming for help in so many different ways. The fentanyl crisis, the opioid addiction crisis that our youth are facing. The social isolation, which we know is disproportionately impacting our aging population. The economic stresses that each of us are facing right now. And the issues that are often beyond our control are leading to a feeling of being unstable and a feeling of a loss of hope. But we are fortunate in Montgomery County to have extraordinary organizations who are on the front lines working on this issue and trying to ensure that we have a safety net, all of us, across our entire county. We are joined today by Dr. Rolando Santiago, the Chief of Behavioral Health and Crisis Services for HHS, Ann Mazur, Karishma Sheth, and Amzi Heck from EveryMind. We also have from Cornerstone, Chris Brandt, and from NAMI, Stephanie Rosen and Steve Robinson, and from the Avery Road Treatment Center, Megan Westwood. These extraordinary leaders and their colleagues have been working day and night, not just since the pandemic, but even before the pandemic, to ensure that we have the right services here in Montgomery County. We were able to actively establish the 988 call center, and we have been working on a partnership and alliance with all of our community-based organizations, as well as our local government. I now want to turn it over to Dr. Rolando Santiago to say a few words. Dr. Santiago.
Thank you, Councilmember Albornoz. I appreciate it. Today we are facing challenges in mental health and substance use conditions that we need to address here in Montgomery County and also across the nation. For example, since 2021, we have seen almost a 75% increase in the number of adolescents who are showing up with opioid-related conditions in emergency departments. To address this situation, county services and the schools are partnering to increase resources and educate parents and youth. We also see that persons who experience a mental health or substance use crisis continue to be high. In the last 2 years, we have been increasing the capacity of mobile crisis teams with clinical training and experience to respond to these crises. From one team, we now have the ability to dispatch 3 teams during the busiest hours of the week. We also see that for many people, the jail or emergency rooms become the default places to stabilize them from a mental health or substance use crisis. Jail should not be the alternative for mental health or substance use treatment. Emergency rooms are already overcrowded in Montgomery County. We plan a restoration center as a place to provide the stabilization services that these individuals need rather than sending them to jail or an emergency room. So thank you, and let's all celebrate together this Mental Health Awareness Month. Thank you.
Thank you. Also want to recognize in the audience is Dr. Davis and Dr. Stoddard. It's been an incredibly important relationship and partnership between the council and the executive branch, especially over these last few years. Next, I want to invite Ann Mazur, the CEO of EveryMind, to say a few words.
Thank you, Councilmember Albornoz. Good morning, everyone. EveryMind's mission is to strengthen communities and empower individuals to reach optimal mental wellness. For 66 years, EveryMind has positively impacted the mental health and wellness of the Montgomery County community through counseling, care management, and education services in partnership with the Montgomery County Department of Health and Human Services. Our mental health programs provide no-cost services for every stage of life, including services for veterans and individuals experiencing homelessness, school and community-based mental health services, and 24/7 support, supportive listening and suicide prevention through the 988 call, text, and chat center that Councilmember Albornoz just mentioned. This May, we're joining our partners as well as the county to support mental health. We are holding our annual Every Mile for Every Mind, which promotes the importance of connection between nature, mental health, and physical health, and raises awareness and funds for mental health. Walks are free for everyone in the community to join and occur on Saturdays, Sundays, and Wednesdays from May 6th through May 31st. In collaboration with Montgomery Parks, our kickoff is this Saturday, May 6th from 2 to 4 at Germantown Urban Park. This event, called With Parks in Mind, will include family-friendly activities, resources, and community partners, beautiful art by Chalk Riot, and the kickoff Every Mile walk through the park. Many of the community partners up here with me today are also joining and will be providing resources at the event. Also this month, we have a free webinar in collaboration with our local hospitals titled Navigating Behavioral Health Services. Topics covered include types of behavioral health providers, how to select a provider, how to access mental health services if you don't have insurance or you're underinsured, and crisis resources. The virtual webinar is on May 11th from 6:30 to 7:30 and is available in English and Spanish. For those supporting youth in their lives, you're offering a free youth mental health first aid training on May 19th. This all-day virtual webinar equips adults supporting youth learn the signs, symptoms, and ways to get help when a youth is experiencing a mental health problem or a crisis situation. I invite everyone to visit our website, every-mind.org, for more information or to sign up for any of these free events to support your mental health this May. We're excited to partner with the county, with all of the partners behind us, to offer these free events for every member of the community to recognize Mental Health Awareness Month this May. Thank you.
Thanks, and I will be there on Saturday, possibly with my dog Coco. We'll see. Next, we want to invite our final speaker this morning is Chris Brandt.
Good morning, and thank you to the council for this proclamation, and thank you for the partnership we've had for over 50 years in this county. Because of the services that are delivered in this county, over 3,000 clients of ours are receiving the services that they definitely deserve. We have an art program called Studio Insight that we're hosting an event on May 24th at the Glenview Mansion that all of our 100% of the commission of that art goes back to the client. It is a great program for people to express themselves in a creative way. And secondly, because of the partnership with the county, we have now just expanded to Southern Maryland in 3 counties, Calvert, Charles, and St. Mary's. And so it's because of partnerships like the county government that puts the resources into organizations like ours that we're able to help more Marylanders. So thank you.
Thank you, Chris. We have a lot of work to do, but we've got the right team in place to do it. So without further ado, I will now read the proclamation. Whereas May is National Mental Health Awareness Month, a time to reflect and educate our communities on the mental health crisis impacting our residents who struggle with significant loss, grief, substance abuse, homelessness, and trauma, especially given how much our youth have been affected by the multiple upheavals they have experienced in recent years. And whereas more than half of Americans reported that COVID-19 pandemic had a negative impact on their mental health, with 781,000 Marylanders reporting a current mental health condition. This growing national crisis is compounded by the increasing rates of suicide, with Black Americans and Hispanic populations experiencing the highest increases. This crisis is exacerbated by the simultaneous shortage of behavioral health providers, many of whom have experienced exhaustion from the unrelenting nature of the services needed. And whereas the fentanyl crisis in our schools and across our community is having dire consequences on public health, and Montgomery County's first responders, schools, staff, providers, and residents are trained to administer naloxone, the naloxone nasal spray to reverse opioid overdose. And whereas Montgomery County is fortunate to have a cadre of organizations staffed by professionals and paraprofessionals, all of whom are passionate in their support of our residents through the provision of mental health and behavioral health services, including staffing 988. the Suicide Crisis Lifeline that has experienced an exponential increase in text, chat, and call demand. And whereas the Center for Disease Control and Prevention recently released the Youth Risk Behavior Surveillance Survey, indicating that a third of young girls and 70% of LGBTQ+ youth report alarming increases in poor mental health and suicidal thoughts, which solidifies this county's commitment to working with all partners to address the mental health needs of our greatest treasure, our youth. Now, therefore, be resolved that the County Council of Montgomery County, Maryland, hereby recognizes May 2023 as National Mental Health Awareness Month and calls upon government, public and private institutions, schools and businesses to ensure the well-being of our youth, families, and communities as a critical imperative, and to reduce the obstacles that often prevent individuals from seeking help as we align our commitment to address mental health holistically and equitably. Presented on the second day of May in the year 2023, signed by myself and our council president.